Good evening and welcome to our COVID-19 update. I'm Ladi Akiridoluale. Here are the highlights at this hour. 32 states of the Federation get 1 billion naira each to facilitate increased testing for COVID-19. Election Observer Group criticizes lack of compliance to COVID-19 protocols during the weekend's Edo governorship election. And UK coronavirus alert level upgraded from 3 to 4 as medical authorities predict 50,000 cases a day by mid-October if non-compliance to protocols continue. The Presidential Task Force on COVID-19 says it has disbursed 32 billion naira to 32 states of the Federation, asking those states to prioritize testing as fatigue has already set in most of them. The national coordinator of the task force, Dr. Sonia Liu, stated this at the bi-weekly news conference of the Presidential Task Force in Abuja today. The Minister of Health at the same event asked states that are planning to further reopen their economies as well as schools to exercise serious caution as 10% of all the treated cases in the country are below the age of 19.
The number of reported cases daily has declined nationally in the last few weeks, yes. We have seen a 36% decline in August compared to July on national figures. But there's more to this than national figures. One critical issue is the number of tests being done. And yes, the number of tests that are being carried out across the country has actually declined. But another important indicator that we look at is the test positivity ratio. And if we look at the highest numbers we had in June, July of 20%, we're now down to about 7% nationally. So you might think that that is good news that we should be celebrating. Unfortunately, we cannot celebrate this until we test sufficient numbers in every state in the country. So in states like Lagos, FCT, Kano, where the testing numbers are high, indeed, they can go to town and say, yes, we have confidence that our positivity rate is coming down because our testing numbers are high. But in states where they're not testing, we're basically driving blind. And in some states, we just have to work a little bit harder. We can't make any interpretation on the data in Taraba, Adamawa, Kogi, Nasarawa, Niger, Kebbi, Zamfara, Jigawa, or Yobe. We simply do not have enough data coming out of these states to say, are we improving? Are we not improving? Where are we? So we have to work together. So in summary, it's way too early to make any interpretations of whether we are flattening the curve or not. Some interpretation can be made in Lagos, in FCT, because they're testing enough to know where they are. But we can't do this on a national level. And that's why it's so important that we keep pushing this work across the country. Yes, we report the figures on a national basis, but in reality, the drivers of this epidemic are different across the country. So we have to really have a subnational understanding of what is going on.
If you believe that you cannot afford to pay for the test, please note that there are 69 laboratories certified by the NCDC throughout the country, and all of these provide free tests. We have released money to the state governments recently, to 32 state governments. Each state government was given ₦1 billion. This is for the purpose of driving their COVID responses. And we are asking them to please prioritize testing in addition to surveillance activities linked to COVID-19.
The PTF briefing earlier today, Dr. Sonia Liu and Dr. Chikwe Ihekwazu. Meanwhile, a civil society organization, the Center for Democracy and Development, is calling for massive COVID-19 testing in Edo State following reports of non-adherence to health protocols during the last governorship election. Presenting the center's final observation report, its executive director, Dr. Hidayat Hassan, is asking the Independent National Electoral Commission to improve the implementation of the protocols for the conduct of elections during COVID-19 ahead of the Ondo governorship election next month.
The Edo governorship election is the first major exercise to be conducted under the COVID-19 pandemic. From the onset, the Independent National Electoral Commission had set out the protocols for COVID-19 during the election. However, the protocols were not followed during the exercise.
The non-observance of the COVID-19 protocol during these elections. And I think that we place on the doorstep of both citizens and, of course, some to the electoral management body itself. Now that a winner has actually been declared, it will be very good to be proactive and conduct massive testing in the state to prevent a health outbreak.
While commending INEC and security agencies for the conduct of the election, the center believes there is still room for improvement.
We do not rest on our oars. To emphasize, as the pre-election atmosphere in Edo clearly shows, there are still serious threats by various actors to the sustainability of democracy in the country. So that as we move ahead, we look back to see where are the snares, where are the minefields that may negatively detract from future elections and set us back to where we were before.
According to statistics from the center, the Edo governorship election in 2003 recorded 78% voter turnout. The numbers fell to 40.5% in 2012, 32.3% in 2016, and 25.2% in 2020. At another news conference, the Nigeria Civil Society Situation Room agrees that the decline in voter turnout calls for concern.
The voter turnout was low compared to numbers of collected PVCs registered for the election. This may have been caused by the rhetoric of violence perpetrated by the main candidates and their supporters ahead of Election Day. There may also have been a reduction caused by the prevailing public health concern of COVID-19.
The conclusion among the civil society groups is that more needs to be done to sustain the nation's democracy.
The chairman of the Adamawa State Primary Healthcare Development Agency has commended the personnel of the agency for their role in the containment of COVID-19 within the state. He made the commendation during an interview with Channels Television in Yola, the state capital. According to him, the staff of the agencies played prominent roles in risk communication through awareness creation in various health centers located in communities across the state.
The Adamawa State Primary Healthcare Development Agency has a central role in the containment of COVID-19. As an agency of government, it has the widest reach and highest number of staff in all the nooks and crannies of the state. Their presence is in the 226 wards of the 21 local government areas of Adamawa State, over 7,000 health workers, and many more as volunteers.
And we have surveillance. We are very active in surveillance. And even currently, in terms of lab sampling and all these things, our staff, personnel, the laboratory staff of the Primary Care Development Agency have been involved in taking samples, sample transport to the state capital. And also, when we have a confirmed case in terms of environmental containment, the staff of the agency have been very central in decontaminating those places, whether residents, whether offices, whether hotels, other health facilities. Our staff have been there doing their job. Also, during the pandemic, we trained over 2,200 volunteers at community level. These are people who live, work, and reside at the community, and they have been playing critical role. We've empowered them not just with necessary knowledge and skills, But we also provided some IEC materials with key messages about COVID-19, which they have been using to reach out to people in their neighborhood and their respective localities.
The agency is also doing well in creating awareness, providing enabling environment and advocacy messages through the media to pass across important messages to the people as efforts are aimed at mitigating the spread of COVID-19.
So a lot of advocacy have been done. The State COVID Containment Committee have done a good job. The DSNO, the Disease Surveillance Officers, done a lot of jobs. So the awareness is quite okay, it's quite high. A lot of people now understand the importance of hand washing, use of sanitizer, social distancing, and use of face mask. So if you look at the indices or the statistics of Adamawa State, you can see that we're at the very bottom up to now. The transmission is not, or the infectivity of COVID is not very high.
The efforts of the Adamawa State Primary Health Care Development Agency and its workforce has in no small way contributed to the low spread of coronavirus, which is largely responsible for the drop in the number of positive cases. For weeks now, no positive case has been recorded in the state.
From Adamawa to Cross River State, where the government there has kicked against stigmatization of those with COVID-19, as the act discourages people to avail themselves of testing following that fear, saying COVID-19 is not a death sentence. Speaking in Yakura and Abi local government areas of the state, its health commissioner, Dr. Betta Edu, stressed on the need for community leaders to get involved in the fight against COVID-19.
This is meant to be a distribution of face masks by the Cross River State government officials to residents of Yakura and Abi local government areas to curb the spread of the coronavirus in the communities. However, orderliness and adherence to safety protocol seems to have lost essence here. On a calmer scale, sample collection is going on within the communities. Awareness is also being created on stigmatization of those who have volunteered to give samples.
There is the fear factor. So people are afraid, they feel they are going to poke their nose and it's going to be very uncomfortable for them. At the same time, they feel everyone who comes out for a COVID test would be said to be positive. And then, of course, finally, people are afraid of stigmatization. If they say I'm positive, how would I be able to go back into community? How will I be able to mingle with the people who I mingle every other day with? My landlord might send me packing out of his facility, amongst other challenges. And that's why people are saying, no, we don't want to test for it. We're afraid of it. We're not sure there's COVID and all of that. But I think we continue sensitization, engaging the Christian Association of Nigeria, engaging all the key gatekeepers in communities, the ward development officers, traditional rulers. We are beginning to get more and more people in community come forward to get tested for COVID and, of course, use the health facility for other diseases.
Commissioner for Health, Dr. Edu, further explains that vulnerable members of the communities should also key into the healthcare project of the state government.
Several health services have suffered some kind of barrier or issues because of the COVID-19 pandemic lockdown. And indeed, it has been difficult for health workers to act without fear in their health facilities. So basically what we're doing is to sensitize health workers, build that link between health workers and ward development committee officers, provide PPEs for health workers all across the state, and encourage them to continue to deliver quality healthcare services to our people all across the state.
As the figures from the NCDC shows, Nigeria is all out to flatten the curve on COVID-19. Situations like this, however, tend to take the process backwards.
In Nasarawa State, the government says it remains unrelenting in ensuring its residents comply to the COVID-19 preventive guidelines. Our correspondent, Halima Gayam, tells us about a new strategy in place for rural communities.
Some residents of Nasarawa State, a huge percentage of them, have lately been flouting safety protocols. The government have used enforcement. It has also embarked on several awareness campaigns, but all to no avail. With this new behavior, the government has another strategy. Here is the deputy governor, who also doubles as the chairman of the state COVID-19 task force.
Nasarawa State is the first state that has created so many subcommittees, all in the aim of increasing awareness and getting the people educated. We have already constituted our task force committee of traditional council, and that was inaugurated about 2 weeks ago. And we also liaised with the House of Assembly to also constitute an ad hoc committee on COVID-19. We've also requested the Jamaat al-Nasr Islam, JNI, and Khan to also form committees on COVID-19. All these are a drive towards creating awareness and sensitizing the people. And we'll also have subcommittees working in all the local governments and also taking it right down to the wards and to households. We've acquired public address systems that are used now and involving town criers that are going around the states to further educate the people and let them know that COVID-19 pandemic is real. And also educating them on the necessary precautions they need to take. And that will continue to do, and hopefully we'll get there.
The government is hoping that with the new approach to slow the spread of the virus in the state, adherence level would improve in the coming days. Halima Gayam for COVID-19 update.
In Ogun State, all categories of schools have resumed and are open to students for academic activities more than 6 months after they were closed as a result of the COVID-19 pandemic. As monitored in Abeokuta, the state capital, safety protocols were strictly adhered to at the various schools visited. Students and staff have been asked to take responsibility to curb community spread and flatten the curve of the pandemic in both the schools and the communities.
After 6 months of academic inactivity across schools in Nigeria, students are back at their various schools with warning on strict adherence to the COVID-19 safety protocols. In Abeokuta, the Ogun State capital, as expected on the first day of resumption, boys and girls engaged in cleaning up their environment to ensure a smooth teaching and learning process.
All the guidelines given by the government are really fully observed. If you go to our classes, you see that there is social distance, the students are well spaced out, and looking around, you see that the students and the teachers both are wearing face masks.
At the state-owned Moshood Abiola Polytechnic, students, staff and visitors alike were subjected to proper checks to ensure compliance with the laid-down safety protocols for being allowed into the campus. One after the other, temperature checks, hand washing, amongst other processes were observed.
It is my own responsibility to make sure I work alongside the lay-down principle in order to reduce and to curb this spread of COVID-19 in our country today. Now, it is also my responsibility to relay the message to my colleagues and also to call others to attention whenever I see anyone who is not doing the rightful, who is not doing the needful.
The acting rector of the institution, who monitored compliance, challenged the students and staff alike to take responsibility as he unveiled some of the measures in place to ensure less population of students, safety and smooth teaching and learning.
We have also told them that not all students could come to school, so that they should make more use of the portal, where we have already uploaded significantly the course outlines, the contents of the course outlines on the portal, so that students can stay at home and still learn. So, but the students we are expecting on campus are the students that will be involved in studio work and laboratory work.
Come closer. Taking responsibility and observing all laid-down safety protocols is a sure way of containing the pandemic.
A low turnout of students was registered in schools in Taraba State amidst the COVID-19 pandemic. A visit to some of the schools in Jalingo, the capital, also shows low compliance to the COVID-19 safety protocols for schools reopening. Some students who spoke to our correspondent, however, expressed excitement to be back to their classrooms, but they also want their safety guaranteed.
Gates and classrooms under lock and key is what has characterized schools in Taraba State since March the 24th, 2020, when they were closed because of the coronavirus. 6 months down the line, schools have reopened and students flood the school environment thanks to the directive by the state government. However, only a handful observed the COVID-19 protocols, as most of them exchanged pleasantries without regard for the safety guidelines. Nevertheless, the parents are seeking for proper safety for their children while in school.
It is actually gladdening to see my ward coming back to school after a long while staying at home with me. Looking at the circumstance we are in, my advice to the school is that they should try and maintain all the protocols that are necessary to ensure that safety is ensured.
While the parents canvass for safety, school proprietors are thinking about the burden of aligning both third and first terms to ensure optimum results after the cancellation of the third term by the state government.
In dropping my children in the school, the staff of this particular school, they were there ready with some of the facilities that are being put in place to curtailing some of this menace that we are passing through, that is the pandemic.
They may find it difficult to cope with some topics because some topics are continuation, but we'll do our best. We'll do our best to see that maybe we can fetch the important topic and treat them in the first 3 weeks, and then we'll merge them with the present class. If this will work out, I think we'll be very happy.
In all of this, the students say they are excited to be back.
I've been at home for about 6 months now, away from my friends and everything, and it's a thing of joy to be able to come back to school and see everyone, finally.
I feel very good because now I can keep up with my education.
Reopening of schools is just a part of the phased resumption of normal life in a pandemic situation. The state government says it's not going to lower its guard in the fight against the coronavirus, and it's embarking on a monitoring exercise to check compliance.
As we resume schools, we will have our monitoring teams. The monitoring teams will go around the 3 senatorial zones. We have a team for Central Zone, we have a team for Northern Zone, we have a team for Southern Zone. All schools must follow the rules and regulations of the state government.
For now, compliance with measures against the COVID-19 is expected to be a continuous exercise in schools across the state to ensure the safety of students.
Meanwhile, primary 6 pupils in Bayelsa State are asking for more schooling time to prepare for their common entrance examination. Our correspondent, Dobra Timewood, tells us more.
I am at the Model Primary School, Biogbolo Yenegwa in Bayelsa State, where pupils in primary 6th class have resumed academic activities.
I thank God that we are back to school again. But the period that they give us is not enough for us to revise our subjects. So I hope that the government give us more time.
We have been at home for 6 months and we are just learning for 2 weeks. So, and the date that they gave to us to write the exam is released. So I want to say that they should add, let me say, 2 weeks to the exam so we can learn what we have not learned before.
These are children that have stayed home for 6 months. All what we taught them before, most of them have forgotten them because of the period of time they were at home. Yes, the plans we have here is to this school, and speaking of this school, what we are doing, we ensure we keep them for more than when the government asks us to keep them, so that we can meet up.
As you can see, they are all wearing their face masks, and any child not wearing face masks is not allowed into the classroom.
We are now trying to do what they ask us to do, and as now we are trying the spacing too is okay. Instead of 70 thereabout in the class, it's only 20 in the class. So by that, the spacing too is okay, and we are trying to see that nobody will be attacked by the disease.
There are 2 active cases for COVID-19 in Bayelsa State. The number of confirmed cases still remains at 393, and 370 persons have already been discharged from the isolation center. The state has recorded 21 deaths due to the coronavirus. From Yenagua, Dobra Timiwood for COVID-19 updates.
Staying with schools resumption in Lagos, they've officially reopened today after being shut for almost 6 months. The public schools, however, have only GS3 and SS2 students back in school, while other public students are being engaged via online media. For the private schools, both the primary and secondary school students have resumed classes, and they expressed readiness to take up the challenge of learning as the teachers promise to do their best to close the learning gap.
Before the children came in, we had already marked the classes for social distancing. We have sanitizers dispensers along the corridors, and we have also ensured that everybody is wearing their mask. We've also stopped gatherings, so the assemblies have taken place in the classrooms, and the children are not allowed to go out to the playground. Everything will happen in a small space in the class. Also, the children used to close at 2:30, but now they used to close at 2:30 Monday and Tuesday at 3.
Many had given up the schools would not resume this year. And so when the federal government asked the states to work out resumption procedures, it was one big gift to the students and their teachers. This is what you see as students adhere to the safety protocols before they are admitted into the classrooms. Here is Alakpere Senior and Junior Secondary, accommodating 4 different schools. The students are already learning in their classrooms, and outside, they speak about their preparedness for their forthcoming examinations.
I read always.
I'm very prepared for the examination. I'm very happy to be back in school and learning with my teachers being able to teach me, not virtually, and I can see them and understand more. To stay safe from the virus, I intend to be washing my hands regularly between 1 hour to 2 hours daily and stay 6 feet apart from other people.
The teachers and parents are excited about the resumption, even though it comes with a new normal.
Clearly, the teachers and the nannies had been trained on, on the safety protocol. And I don't know if, they had to split it intentionally, but the number of pupils in this class had reduced. So which, of course, is another encouraging thing to be sure that they're not, cramped up in the class.
The assemblies have taken place in the classrooms, and the children are not allowed to go out to the playground. Everything will happen in a small space in the class. We have put in place what we call a recovery curriculum. So we're going to have to do a little bit of recovery from where we stopped before we move into the term's work actually. But they are in a new class. So it's a new session, it's a new term.
The next couple of weeks will surely present new challenges in the running of schools. But there seems to be a strong commitment on the part of the teachers and school management to ensure that the students obey all safety protocols and guidelines put in place by the NCDC. Titilayo Haberewu, Channels Television News.
The Nigeria Center for Disease Control, the NCDC, reported 3 deaths in the last 24 hours in Adamawa, Benue, and Kaduna, increasing the fatality toll to 1,098. This is as the country recorded a daily count of 97 COVID-19 cases, a sharp decrease from 221 and 189 reported on Friday and Saturday last week. The cases are reported in 11 states and the FCT, of which Lagos had 46, Kwara 12, Rivers 11, Adamawa, Niger, Ogun, and Osun had 4 each, Ekiti, Imo, and Kaduna 3 each, Plateau 2, the FCT 1. While 138 patients were discharged in 8 states, the recovery count rose to 48,000 7,569. And the total active cases being managed now stands at 7,575. A look at the COVID-19 figures from the different states shows the epi curve taking a downward trend. It also shows that the last time the country recorded over 300 cases was the 24th of August, when 321 cases were confirmed. In the meantime, the NCDC says there's no scientific evidence that disinfectant tags, often known as air doctor, can protect people against COVID-19. It says that the composition and concentration of the active ingredients in air doctor is ineffective against SARS-CoV-2, which is the virus that causes COVID-19. Chlorine dioxide and its products, which are contained in such tags, can lead to serious health effects, especially in children. Let's talk to consultant public health physician Dr. Tolu Olufunlayo, who joins us from the Yaba area of Lagos. Dr. Olufunlayo, good evening. Thank you for your time today.
Good evening. Thank you for having me.
Well, the schools are open, and would it be fair to say that everybody is having their fingers crossed to see how this works out?
I totally agree. Yes, we are cautiously optimistic that things will go well if we stick to the recommended protocols.
Many of our guests, like you, who are in the medical field, have said that this one is kind of touch and go, and we've already seen evidence of that. One of the reports we played before this interview came from Taraba, where the really young ones are actually hugging themselves very much and running after each other. And this was what we talked about that would happen when this was eventually the case. I don't know what you make of that, and if this is widespread, what could be the implications?
Okay, well, the first thing I want to say is I would like to commend all the various stakeholders who have been involved in putting together the protocols for reopening the schools. I say this because I can see that a lot of thought, a lot of evidence, science has gone into putting these things in place. And the guidelines that have been released by the federal government have been cascaded downwards to the states. And most states, I can't say for all because I haven't been able to see every one of them, but most of the states that have been talked about in the media appear to have cascaded it down to the individual schools, whether public or private. In Lagos State, for example, where we are, the State Ministry of Education has done quite a lot and has an elaborate plan for school resumption. And the Private Schools Association has also commended the way in which these guidelines have been cascaded downwards. And so this is meant as much as possible to mitigate the risk of spread of COVID-19 within these schools. However, coming back to the issue of the very young ones, they have actually been discouraged from resuming. And when I mean the very young ones, I mean those who are 5 and below, for several reasons. One, because it's quite difficult to make them understand that they shouldn't, come close to their friends. And also because it's really not recommended for that age group to wear masks. So it's difficult to prevent them from coming together. So I'm not sure what ages those children were, but I would think that the very young ones should actually still be kept away a little more, not because they are likely to suffer more from the illness, but because they may serve as, people who can transmit to the more vulnerable groups of people. But those in primary school and secondary school are amenable to be inculcated in the safety protocols. They're still young. I don't know if you understand what I'm saying.
I do.
Not, but they are young enough to be to receive the inculcation to do A, B, C, X, Y, Z. And so when I want to talk about prevention tonight, that's where I'm going to start from, that both at home and in school, there needs to be repeated trainings. Looking at different ways by which we can explain the risks to them, and then also the risks to the staff. So there should be trainings both within the school and from outside the school to keep everybody on their toes, amongst other things that will be done. So let me leave it here and let you go on with your question.
Now, of course, the other question here is the issue of testing. Because how are we going to get to know if this is working or if this has this will lead or is leading to a rise in our number of cases, and how to go about this is the issue of testing. Now we've been told that the federal government has asked the states to prioritize the issue of massive testing. And it's not just that they should test. They've given them ₦1 billion each and asked them to do this. But a lot of people are staying away because many of the methods by which people get tested these days have become quite expensive, as I have learned. There are people who are quoting figures, especially if you go to the non-NCDC laboratories, of 45, 50,000, 70,000, depending on the speed of the test. Isn't this going to present itself as a problem if we want more people to be tested, especially at the level of the communities?
Okay, let me try and unpack this question because there's so much wrapped into it. First of all, the test is expensive. The Lagos State Commissioner, for example, when we had a meeting with him, explained to us that the test costs about 50,000 naira. So I want people to know that if you do get a COVID test at any of the accredited facilities, you are actually being given a very expensive test. So it's worth a lot, and that's the reason why before now, NCDC has ensured that the laboratories stick to the criteria that they have laid down to be able to, reach those who actually needed the test the most. But we are getting to another phase now. Now we have to understand the burden of disease within our community so that we can understand whether or not we are actually flattening the curve. So I'm very happy with what the new development from the PTF, as was announced today by the various members of this committee. And with the funds that have been given to those 32 states, I'm hoping that there will be a mechanism by which we can ramp up testing. But you see, testing, we have to look at it from both the demand and the supply side. Supply in the sense of the testing centers, the testing commodities, the logistics, access and ease of testing. But there's also the demand side, and that is from the people who need or should be tested. And that must be worked up. Both sides must be worked upon, but especially the side of the demand. So there must be active case search. We've had some active case search in Lagos State, but I think it is to be expanded actively. And if we do mass testing, that to be able to take some of the population and not just test those that have symptoms, then we really, really have to do active case search. So I think if we go this way with the logistics that have been provided, we would be able to better ascertain what is going on in these various states, and we'll also know whether opening up our economy has been accompanied by a spike or it is actually going very differently from what is happening in other climes where they are opening up and they are having spikes in cases.
Indeed. Thank you so very much, Dr. Tolu Olufunlayo, for your perspective and for your time this evening.
Thank you for having me.
South Africa moved to level 1 lockdown today with the Health Minister, Dr. Zweli Mkhize, appealing to the nation to avoid complacency with regard to compliance with all prescribed health safety protocols. While the nation is celebrating its improvements, though, the National Education, Health and Allied Workers are not. They say they want a pay hike to be implemented amongst other demands. They took those demands, to the union buildings in the seat of power today, where they demanded an answer from the president.
It was 2 weeks since the National Education, Health and Allied Workers Union, NEHAW, in South Africa, submitted an 11-point memorandum of demands to President Cyril Ramaphosa's office, and they say they're still waiting for an answer. demonstrating outside the seat of government, the union buildings, on Monday. NEHAW members say they are unhappy over COVID-19 working conditions. Among other things, they also want an 8% salary increase for the frontline workers.
We want all our demands to be implemented. The first general part of the agreement is dealing with conditions of our workers, the working conditions of our workers. The other demands is the implementation of Resolution 1 of 2018, because it can't be that when government has agreed and signed a resolution with the workers' formation, then government comes 3 years later and says, no, we can't implement it.
A total of 240 healthcare workers have died of COVID-19 in South Africa so far, 37 of them from the private sector and 203 from the public sector. NEHAW says they're tired of government silence and want to be taken seriously, as they will keep on picketing outside the union buildings till their grievances are addressed.
The thing that makes us to boil is that when you talk about those 250 workers who have died, they died without being given their salary increases in April. So they have died in vain when government has stolen their increment, which they should have enjoyed.
A virtual meeting between NEHAW's leadership and the African National Congress (ANC) has taken place today, with the NEHAW delegates insisting that they're expecting President Cyril Ramaphosa to address them on their demands. From Pretoria, South Africa, Betty Dibia for the COVID-19 update.
Let's talk now to Betty, who is in the Johannesburg area of the capital. Nice to see you, Betty. Trust you're keeping safe. Let's drive right into it. What is this strike about, really? What are the key demands? What are the key demands that these workers have?
Main thing, better working conditions, as they say. The issue of time out if they feel that they're not well enough, especially if they suspect they've been exposed. These are some of the things that they've raised. The issue of an 8% salary hike, that was actually agreed about 2 years ago, but then COVID happened, and I don't know how if government will be able to cope. But the update of this particular story is that the president has agreed to meet with them, but that didn't happen today. He will be meeting with them, with the leadership of the group on Wednesday.
Indeed, but taking that, of course, as the peg, this, of course, speaks to, because in your report there, it talks about 250 of the members who have died during the period of this COVID and have therefore not gotten these entitlements, not gotten this entitlement. So it brings the general question of, if indeed this is to be called, they haven't withdrawn their services yet, have they?
No, they haven't. They're saying if their demands, they have 11 points on the demand, the memorandum of demands that they presented. So if their demands, maybe they will settle for some and leave some for another day. But if it's not listened to, if they don't get the right response that they would like, they may withdraw their services probably next month. But probably after the meeting with the president on Wednesday, we'll see where next they will be going.
Finally, and very briefly, how much of an impact, if any, has this had on the medical service delivery system?
Well, they haven't withdrawn their services yet. It's just that, remember, this is a bigger union, and they're protesting on behalf of the health workers within that union. That's the thing. So services haven't been withdrawn. They're just hoping for just better conditions, as they say, the issue of PPEs, adequate PPEs, quality PPEs for their members, and then the general working conditions, as well as that salary hike, and including a COVID allowance. I don't know how serious they are about that as well. But service is going on, and the numbers, the health workers are still at work as at now.
All right, then. Thank you so much, Betty, for that update, and do continue to stay safe.
Thank you very much.
United Kingdom chief medical officers have raised the country's coronavirus alert level from 3 to 4, meaning transmission is high or rising exponentially. This comes after the government's chief scientific advisor, Sir Patrick Vallance, warned there could be 50,000 new COVID-19 cases a day by mid-October without further action. Health Secretary Matt Hancock says the country is at a tipping point as he unveiled a £500 payment to help low-income workers to self-isolate and an exemption for childcare to local virus restrictions. Meanwhile, the global number of cases on Sunday topped 30.67 million, with the death toll now approaching 955,000. That's our COVID-19 update tonight. You can go to our website, channelstv.com, and see some of those stories yourself, read some of the further details, and indeed all the updated protocols to stay safe during this COVID-19 pandemic. I'm Ladia Kiridulwale. Good night.